Namaste, myself Padma Sharma, past association treasurer from Innerville district 315. See Cervical Cancer initiative is launched by our international Innerville president Mamta Gupta. It's a flagship campaign to eradicate this deadly disease, cervical cancer. She has already started a series of impactful social media campaigns to create awareness and also mobilizing action. Today, to help us understand more about this critical issue, we have with us Dr. Geetha Nagasree, Senior Surgical Oncologist, and she will share her expertise about cervical cancer and its prevention. Welcome to the show, Geetha garu.
Welcome. Thank you for your very innovative bouquet.
And she is the first surgical lady oncologist from Telangana state. And she is very much renowned in our Telangana state, and she is also Innerville member from Innerville Club of Hyderabad Center. To begin with, Dr. Geetha garu, please tell us what exactly this cervical cancer is and how it develops.
Cervix is the downward part of the uterus. It is like the entrance of the uterus, where the uterus opens into the vagina. That region is called cervical region. Other things is uterus body is different, and uterine cancer is different, and cervical cancer is different. Both etiology is different. Cervical cancer, it is caused mainly by the human papilloma virus. Because of this only there is a vaccine against this cancer, because COVID is caused by the coronavirus. Because it's caused by the virus, we have vaccination against COVID. Like that only, actually cervical cancer is caused by human papilloma virus, which is a sexually transmitted virus. That is the reason we have developed a vaccine against this virus. So this vaccine is a preventive vaccine, which we vaccinate girls from 9 to 26 years. That like before sexual exposure, pre-marriage marriage girls, we usually vaccinate them against this cervical cancer, so that from this HPV vaccine, antibodies will be produced by the body whenever in their lifetime. Because every woman in their lifetime has attack with this human papilloma virus, which is a sexually transmitted virus. But usually with our good immunity, we'll just throw away the virus. The virus will go by itself.
Doctor, what are the key signs and symptoms that a woman should be aware of, and when they should seek medical advice?
Actually, key signs and symptoms means a woman will have white discharge, foul smelling white discharge, intermenstrual bleeding after the coitus, after sexual activity they will have bleeding. These are the main symptoms of cervical cancer. But we should not wait till that symptoms occur and the cancer already occurs. We should, as I told, it's a preventable cancer. Every woman should undergo this pap smear or anything in visual inspection with acetic acid or leucoalidine. So WHO has developed a method which is useful for the developing countries like us, where there is a vast population and resources are limited. So there is visual inspection with acetic acid. Just whatever paramedics also can do this with the speculum, 5% glacial acetic acid if you apply to the cervix, where abnormal areas will turn white. So that abnormal areas they can take biopsy and send to the higher centers. This is the one method of screening, the low cost screening method given for the countries like India.
And what are the main causes of this cervical cancer, and how women can reduce their risk of developing it?
Yes, this is a very important question. As I told, the causative agent is human papilloma virus, which is a sexually transmitted virus. Other causes, other risk factors I have to tell. Risk factors is early age of marriage, where the epithelium of the cervix is very immature, and this virus will enter into the epithelium and make changes in those cells. So early marriage, having childbirth, early childbirth, and having multiple sexual partners, and partner having multiple sexual partners, low, very poor genital hygiene, and also immunocompromised individuals like diabetes, those who are on steroids, especially those who have undergone transplants, who is on immunosuppressive drugs, and also HIV infections. All these are immunocompromised states where this HPV, they are more prone to the cervical cancer.
How effective is the HPV vaccination, and what age group ideally be vaccinated?
Actually, HPV vaccination is almost I think 2006-7. It has come out more than 15 years. It is in the market. It is in the market for more than 15 years. It is actually, antibody formation is good and it is very effective, more than 90% effective. But still, if you vaccinate the girls also, that same screening program should be continued, pap smear every 3 years, or with HPV DNA every 5 years. That to be continued, that screening program, and definitely it should be given to the young girls. US has given the protocol like 9 to 26 years, because early we give that immunity, the production of antibodies will be more. That is one theory is there, because in young age, before because 12 or 13 years, if you vaccinate them, even there are studies that even if you vaccinate very early, like 9 to 13 years, even single dose of HPV vaccine is enough. There are some studies. So early, when we give early, they say the number of antibodies produced will be more.
There is a curiosity around alternative methods of medications like herbal supplements, natural remedies, alternative medications. Is cervical cancer is preventable through such alternative medications?
No. Answer is no. But because now it has become very passion that they want to, they think that allopathy medicine won't act, and we go for the Ayurvedic and all. Now, one thing I want to tell, I'm not against anything, but I say the patients that not instead of this treatment, in addition to taking this treatment, whatever is prescribed, either according to the stage, either surgery or chemotherapy or radiotherapy, according to their individual personalized thing. Apart from this modality of treatment, if you have faith in alternative medicines, you can use it.
We know that immune system of a person plays vital role to fight against any infections or diseases.
Yes, yeah.
Is cervical cancer affects a woman who is fighting with HIV, AIDS or
Yes,
something?
I have already
How does it affect?
I have already told that question about that. Actually, one of the risk factors for cervical cancer is immunocompromised state. People who are on prolonged steroids, or who are undergone transplant and who is on immunosuppressive drugs, or HIV infection. These are all immunocompromised states, and in this, actually, when virus, usually I already told, all sexually active women will have this virus sometime in their life, but when our immunity is good, it fight against that virus and shed the virus off. But when women is immunocompromised, they lose the capacity to fight against this virus and shed it off. So the virus remain in these cells, and it enter into the DNA. It start mutating the DNA. The mutation happen, and that all the changes happen, and the division become haphazard, and they form the tumor.
Okay. Is cervical cancer is hereditary? Are there any genetical factors or family history causes risk of developing the cervical cancer?
In cervical cancer, actually, usually breast and ovarian cancers and colon cancers are usually some percent, like 5 to 10% are hereditary familial cancers. But cervical cancer, the causative organism is human papilloma virus, which is a sexually transmitted virus, and it is definitely not a hereditary cancer.
Dr. Geetha, in your medical experience, what are some misconceptions about cervical cancer that you would like to address?
Actually, more than misconceptions, in India, women is being misled by many people, like relatives, friends, people around them. Usually they tell there is a white discharge, and they tell it's okay, it happened to me only, it is common. When there is bleeding, bleeding is common only. It is like your body is heated up, that's why it is bleeding. Like this, they mislead these women, and women also think that it's very common and we needn't have to consult doctor, it will go by itself. And usually the very sad thing is, still in India, every 8 minutes we are losing one woman of cervical cancer. It is very unfortunate and very sad thing. The cancer, which is a totally preventable cancer, we are losing every 8 minutes one woman. The sad thing in India is most of the women in India come with 3rd stage or 4th stage to the doctors. So they ignore so much the symptoms that they come in the only 3rd stage when the disease is advanced.
How can individuals and communities contribute to the success of campaigns like See Cervical Cancer? What's your advice?
It's a good question. Actually, awareness is very important. That's what we are lacking in India. Actually, for cervical cancer and all, in Western countries like UK and USA, they have the regular population-based screening program, which we are lacking in India. We want our opportunistic screening program, that any woman they want to screen themselves, they'll go to the doctor and get themselves screened. The government has no particular program like population-based screening, that every eligible woman in the every eligible citizen, every eligible woman in the country will be screened against this disease. Nothing, no program like that is existing as of now in India. And India is a vast country with a huge population, where the budget for health is very less, which should be shared between so many diseases, and like infectious diseases, maternal mortality and all. The resources, poor resource countries, but definitely in across the breadth and length of the country, we have lot of human resource. We are rich in human resources, though we are budgetary wise it is very less. Health budget is very less. Across breadth and length of the country, we have lakhs of paramedics, ANMs and ASHA workers. If we train them how to identify these high risk cases, like in precancerous stage, like I already told, WHO has given the model low cost in countries like us, low cost screening in resource poor countries, that like one visual inspection with acetic acid. Because these ANMs, ASHA workers, they are the one who are with the population 365 days. They have the reach to the last house in the country. So if we train them and incentivize them for identifying the positive case, definitely we can screen huge lot of population in India, and definitely we can reduce the burden of cervical cancer in India.
Dr. Geetha, thank you so much for sharing your expertise with us and helping us in understanding what exactly cervical cancer is and importance of its prevention. I hope our viewers also feel more informed and empowered to take action. Thank you once again.